assignment for next week on the cat is to skin the arm. Okay? So just to tell you what you're going to be doing next, you're going to skin the arm. Okay, the forearm. This part of the arm, the upper arm, does not need to be skinned, but you will need to skin. I already don't have any hair. Got to bring one. It's get gross, juicy. My dog loves it when I come home in the afternoon after dissecting cats. I don't know what it is. It doesn't smell like cat, but he knows. He acts differently when I come home and I teach this class. I can possibly smell the cat, but I don't know, he smells something. That's different. All right, so here we go. Your homework assignment for next week is to skin the forearm. Okay, most of the forearm is skinned, so I'm just going to kind of tell you what you're going to do here. So if you've got a little bit of the extra skin, just skin, you're going to go ahead and you're just going to clip it all off. You're going to kind of clip it on down to, I guess, do cats have dew claws? Dogs have dew claws.
Yeah, I think they do.
Do cats, is this a dew claw in cats?
Yeah.
Do y'all call it that? I'm not a cat
I
person.
don't know if it's called the same thing, but it's the same
So,
kind of claw.
so wherever his little dew claw is, you kind of want to clip the skin up to where that little claw is, that little nubbin, okay? So that little nubbin right there, you want to kind of clip up the fur right there. Then what you want to do is, you'll notice that as I pull this up, you can kind of see that there's some pretty thick layers of fascia right here. You're going to take these layers of fascia out, okay? And they're pretty heavy duty. This is one layer of fascia, okay? There's a second layer. So there's two layers of fascia here that you have to get through. See that? There's the second layer. So there's two layers of fascia that you're going to have to cut through. And so you're just going to take and you're going to cut the fascia and you're going to skin that arm so we're ready to go and get into the arm next week. Now once you get down and you can start to see the muscles and you can start to see the ligaments, you're good. Again, little tiny snips are always going to be better than taking really big ones. So here, right there, I finally am underneath that last layer of fascia right there. And I'm to the muscles, okay? Now there's a trick. There is a muscle that runs right along the top of the arm right here. And he's called the brachioradialis. You may not be able to see it, but on your cats you will. If you did a really good job of dissecting that acromiodeltoid out, you'll start to see that little muscle right up under here. And it's this little thin band right here that I'm flicking. That's the brachioradialis. He kind of is going to be sitting, this is your clavodeltoid, here's your acromiodeltoid, okay? This is one of your tricep muscles. This little muscle, this thin band right here is called the brachioradialis. He comes along over here and follows this big blue vein that's along the surface of the arm right there. So when you're clipping the fascia, clip around this one. So right here, I can see that muscle. Maybe on your cat you can't. On this one, it's got a good guide. It's just this little thin band. You might be able to find it if you dig for it. There's also a nerve, so you can see right about here where my probe is coming through. This part is actually the muscle. This is a nerve. Don't cut any of it, just on the safe side. And even if you get the blood vessel, you get the muscle, and you get the nerve, we're just going to call it all the brachioradialis when you clean it up, okay? Because separation of this guy may be a little bit tricky. But if you do have a nice guide, you can kind of follow like right along here. And you can say, okay, I'm going to cut all the fascia all the way around the arm. But when I get to here, I'm going to leave it until we start to dissect it. So pick a little wide berth on either side and just create this little band. And it's going to be a little band that's probably going to have a nerve, a blood vessel, and it's also going to have a muscle, but that's okay, all right? So leave you a little bit of room around that band right there, and you can actually take your probe and you can poke him through on the other side, right about here, and that's the muscle right there. And then you can kind of trim that band up if you want and free it up once you come up under here, because you can see that there's quite a bit of fascia right there. Make sense? Okay. All right, so here we go. On to the neck. Okay, so for the neck, we're going to start out with the masseter. Masseter's your big cheek muscle. Okay? your big cheek muscle. So that's why I had you skin the cheek, so that we could find the masseter. So what we're gonna see is a couple of blood vessels that are gonna be coming up and moving around here along the sides here of the neck of the cat. These are your jugulars. Okay, so this is gonna be the external jugular coming up here. You're gonna have another one here on this side. You also have one that's gonna be over here. It's gonna be coming across. That's the transverse jugular, okay? All right. So we're gonna kind of leave those blood vessels alone as much as possible. They're not ones that you really have to know, but the less blood vessels that we cut, the better off. You're also gonna notice some glandular material right over here on the side. This is actually going to be one of the salivary glands. It's actually the parotid salivary gland. So you kind of see this little globular kind of mess. It doesn't look like fascia, it doesn't quite look like a muscle, but it's kind of glandular looking. This is the parotid salivary gland, okay? Now, you can see as I'm tugging, there's some fascia underneath here, because we really can't see and define out that muscle real well. So you're gonna just cut through that fascia. If you nick the jugular, it's okay. We'll try not to, just for good practice. And what we're gonna do is, you'll notice again, there's quite a bit of fascia up under here. And we're simply going to just gently move the parotid salivary gland out of the way, okay? We don't want to destroy it. We don't want to do anything to it. We just kind of want to move it out of the way so that we can actually see that masseter muscle. And that's all there is to it. Define out your masseter muscle. There he is. Okay, right there. Big cheek muscle. Just clip a little bit of that fascia out of the way. And then there he is, muscle number one. Pretty easy to find. He's an easy one. The digastric is also going to be a really easy one to find. The digastric is this muscle right here. He makes an upside down V right there. Okay? Upside down V is going to be the digastric. Now, the digastric, again, is pretty much like the masseter. You don't really have to do too much, but you can actually see where he separates right here. And so if you just gently take your probe or your scissors and you just kind of separate him away from that next little muscle right here, just gently tweak it just a little bit here. Now, it looks like they might have gone a little bit too deep when they cut the skin off of this side. So, just again, just be careful. He's really nice on this side and pretty nice over here. Just got a little bit, grabbed a little bit when it was skinning it. So just, as you skin it, try to be careful so you get the nice, the little jagged pieces, but there's a nice side over here, so that's a nice one there. All right, so you just kind of want to take that probe and just gently do this number. This muscle separates pretty easily, so you can kind of see that if you mess around with it too much, it's going to get all kind of jagged and, you know, shredded, okay, kind of like pulled pork. I don't have barbecue tonight. I'm having shredded chicken in my soup tonight, so that ought to be fun. All right, so here we go. There's the digastric. Now, what you can see from the digastric is if you just pull him out of the way gently like this, you've got another muscle that's laying straight right here. And the muscle fibers actually are going to be going straight across. So my muscle fibers from my digastric come up like this and come up like this and make an upside down V, okay? Then I've got this muscle that's sitting right here. That little muscle that's sitting right here, the muscle fibers are going straight across. That muscle is called the mylohyoid. Okay? So some of these muscles start to get a little funky. They got these weird prefixes: mylohyoid, stylohyoid, sternothyroid, sternomastoid, stylohyoid, if I didn't repeat that. Down at the bottom of that first page, you've got a guide to what those suffixes mean. Those suffixes are going to kind of help you learn those muscles and trace where they attach to and help you to name them. So for example, mylohyoid. Okay, so when you think of mylohyoid, hyoid is the hyoid bone. That mylo is muscle, and mylo is going to come across to the hyoid bone. That's that horseshoe-shaped bone that's sitting right about here, okay, right up under our chin. You can see it if there's a skeleton in here. Y'all know what the hyoid bone is, right? He's right up under the chin, and he doesn't articulate with anybody else. He's just kind of that floating bone. Muscles and tendons, and those are going to connect to that hyoid bone, okay? So we're not going to do too much with this hyoid bone, mylohyoid muscle yet, but we are in a minute. So what we want to do is we want to come down, and you do want to find your next muscle, which is called the stylohyoid. Now, the stylohyoid is a little tricky one. Okay. He attaches down here, and he's a little bitty thin band. Thin band that's going to come across right here, across on either side. Okay? Now the trick is you just want to just kind of find it. You don't want to really dissect it out. And if I really am careful, I can get both of them intact. But it depends on how patient I can be. And there's one band of my stylohyoid right deep down here. Now, if you have to, you can come in and you can cut the transverse jugular at one little place right here. And we can pull him over. Okay? Just pull him over just like that. That will help you to kind of find that stylohyoid a little bit. All right, I've got one band of my stylohyoid right here. That little guy right there, I'm looping with my probe, is the stylohyoid. It doesn't look like much from where you might be seeing him right now, but you'll notice him. He's this little band of muscle that is cutting across the base of that mylohyoid. He's got one here, and there will be another one, and there it is, right there. Okay, so on this one, I actually got both of them today. There, it's the first time I've gotten both of them in a while. They're thin and tiny, and so there he is right there. Just to kind of separate him out so that you can kind of see him. I'm trying to poke through that little bit of fascia, but it's probably not worth it. Okay. Right there. Those are my two stylohyoids intact, one here and one here. They come down as my mylohyoid comes across. Just imagine this as being one big band that stretches out here and stretches out over on this side. Now, this guy is named for where he attaches. Stylohyoid is going to attach to my hyoid bone. So my hyoid bone is right about in here for the cat. It's also going to attach to the styloid processes. You remember those on the skull? Those real pointy wings, okay? So it's gonna move over and attach to that styloid process on either side of the skull. And so if I pull them out here, I can get them a little nice and tight, and you can see that's one stylohyoid, there's another one right there, okay? All right. Now, we're gonna come down a little bit further down here into the throat, and we have to kind of make some, incisions here and cut some things to kind of make it fit just a little bit. And what you want to do is you're going to find that there's a muscle that is going to be going and making an upward V. Now in the neck region here, unfortunately, what happens is when they cut the neck of these guys to inject them, sometimes these muscles kind of get a little damaged and distorted. And you kind of have to fake it just a little bit. On this side, they pretty much chewed this up when they cut into them to inject them with the dye and the latex. But you're going to see a muscle. Some may have a little bit better. There's a little bit of fat right here around this little guy's neck too. And so if we remove that, we might be able to see a little bit more of the muscle. The muscle I'm looking for is called the sternomastoid. Okay, sternomastoid. Okay. Now, if I get that little fat pad out of the way there, we can kind of see a few more of the little striations of the muscle just a little bit. The sternomastoid tells you exactly where he is going to attach. Okay. And the sternomastoid is actually going to attach to the sternum and to the mastoid processes. And he's going to kind of hide behind some of these salivary glands that you see here. Now, this is the sternomastoid right here. Sternomastoid here. Okay, not much one over here on this side. He does kind of make a V right here, but this is the sternomastoid on this side right here. So again, it depends on the cat and how they injected it. Okay. On how good you're going to be able to see that muscle. But this is the sternomastoid. It makes a nice V right here. Okay? Sternomastoid. Cleidomastoid is going to be hiding kind of behind it. Okay? Now I do need somebody from y'all's group. I do one for one muscle. And I need y'all to do the same kind of thing that you did before by pulling down, pulling up, pushing the arm down and pulling the head away. Yeah. Nope, away from you. There you go. All right. What you want to find is you want to find that clavotrapezius again and your clavodeltoid. So remember that your clavodeltoid is here, clavotrapezius is up here. We want to find this jugular right here. That's the external jugular right here. And what you want to do is if you pull it back, you can kind of create yourself a little pocket. And you can see that there is going to be a separation of the muscle right about in here. And it's like this big hole. I'm going to stick my scissors in. Okay? So here I've got my sternomastoid muscle coming up right here. All of this is sternomastoid. I pull that jugular back. And you separate this muscle right here from that clavotrapezius. You'll have your cleidomastoid. So what I'm doing now is I'm simply pulling away in my forceps. That's my clavotrapezius. Okay, he's running down here along the side of the neck up underneath the head. And I've got this muscle right here. Stick my probe in, and you can see that muscle right there, right? I loop my probe around it and behind it. It's not too tight. I can pull it through right there. That's the cleidomastoid. All right, cleidomastoid. He's going to attach to those mastoid processes as well, just like my sternomastoid is. But he's also going to, cleido refers to the clavicle. So he's actually going to attach to the clavicle. So he's going to come down here and attach to the clavicle of the cat. And back up here, he's going to run this way. So it's kind of like I've got my sternomastoid running in this V. Then I've got him kind of at a little bit of an angle up under here. So imagine from the clavicle all the way to those mastoid processes kind of running in this direction. So if I use this as my probe, this is my cleidomastoid direction, and then if I use my forceps, this is kind of what they look like. My sternomastoid would be on top, my cleidomastoid would be on the bottom underneath, and they both would join at the mastoid processes, where they kind of intersect a little bit, so to speak. Got it? Okay, so it's not as hard as you think. You just have to have somebody do this number where they're pushing and pulling the head away, and then you can find that little tiny pocket. There's not much to do to trim this muscle out. I mean, you just kind of find it, and that's about it. You will separate it from the clavotrapezius, and you can see here that where my probe is, if I really work my probe to the other side, you can see it now. Maybe if I get there's my probe, the end of my probe is sticking out right there. I'm now back to where we separated all those muscles from the upper back. So you'll be able to see it pop through. Make sense? So you're separating that clavotrapezius away, and there's my nice cleidomastoid. Okay? All right? Any questions? All right, masseter. Digastric is here. Mylohyoid, stylohyoid, sternomastoid, cleidomastoid. Now we have 5 more muscles that are deep throat muscles, but some of them aren't so deep, okay? So, I'm gonna have you stick. Get a partner to push down on the chin. Gonna get one of your lab members to push down on the chin. The first muscle is pretty easy to see. And that first muscle that you're going to see is, actually 6 muscles. I forgot the sternohyoid. That's who I'm finding now. The sternohyoid, when you have somebody push down, is this long muscle that you see right here. Muscle fibers are going to run parallel. So this muscle is called the sternohyoid. So who does the sternohyoid attach to? Sternum and the hyoid bone. Okay? And so he runs straight up and down, and so down here somewhere is where he's going to attach into that sternum, and then up here at the top, he's going to attach to the hyoid bone. Now, when somebody puts the heel of their hand down like that and pops that chin up and pushes down on it, it should pull this muscle pretty tight. And you can see where it separates, correct? Okay, yes? All right, that's what you want. You want to find that little separation there. And then again, gently. These muscles are kind of thin. On a male cat, they're going to be a little bit heavier duty, a little tougher. Female, a little more delicate. You got a little bitty female, it's going to be a little super difficult. Very delicate, rather. And you're going to take your forceps and gently, because these guys will shred. You're going to take your scissors and you're just going to kind of run up under here, and you're going to just separate it and pull it apart. And you're going to see how that muscle separates just right here. Okay. And you're going to find a muscle sitting right on top of the larynx. Okay. Can you use your other hand to do that? There you go. All right, so here we go. Here is the trachea, and you can see the ridges of the trachea like a soda straw. Okay. We'll pull him back, So there's my ridges of my trachea, and right here, right on top of the swollen part, I keep giving you the forceps. Right there, sitting on top of my larynx, right here, you're gonna see a little tiny brown muscle. That little tiny brown muscle is actually going to be the cricothyroid. The cricothyroid refers to two pieces of cartilage that you have on your larynx. You've got the thyroid cartilage, which is this lower cartilage. You've got the upper cartilage here, which is going to be the cricoid cartilage, okay? And so the muscle that sits right on top of here is called the cricothyroid muscle. He's just this little tiny brown kind of muscle. You're not going to be able to see too much of it. But he's a little bitty brown patch that sits on top of the larynx. And he is indeed a muscle. So this little area that's kind of discolored, it's got a little blood vessel running across it. This little thing right here, that's your cricothyroid muscle. Okay? Now, Jen's got it pulled back really good here, so we can see the next muscles here. The next muscles that we've got are going to be my sternothyroid and my thyrohyoid. They're my last two. Okay? Alright, so you can see this muscle here, right there. Do you see this guy right here? Okay? This is my sternothyroid. Tells you exactly where he attaches. So it should help you with these learning needs. He attaches down here at my sternum. He attaches up here to my thyroid cartilage. So this is my sternothyroid. Okay? Now, grab it down, grab it deep. There we go. All right. Now, the next muscle is right here. I might try to find it on the other side. It might be a little bit better, easier to see. But about right here to the hyoid bone is another muscle. And that's my thyrohyoid. It's like these guys are welded into place. Sternothyroid is welded into place right there at the thyroid cartilage. My thyrohyoid comes up here, and he's welded to where my hyoid bone is. Okay? I'm going to see if I can find him over here a little bit better. Let's see if I can find him on this side, maybe. You're going to have a pair, so they're going to be on either side. So on this one, the rule of staying on the left side of the cat doesn't really matter because you're working in the neck. And so, again, you've got a pair. And so if you can't find it and it doesn't reveal itself really well on one side, you can look on the other side. And as it turns out, it reveals itself pretty well on this side. Here it is. So, here on this side, you can see the same set of muscles. My sternothyroid isn't as good on this side, but here's my sternothyroid. My thyrohyoid is really good. He's sitting right here. The thyrohyoid runs right along the side of where the larynx is. So my sternothyroid runs along my trachea. My thyrohyoid is going to come up and run along the swollen part of my larynx. Okay, so that's where you're going to look. All right, almost done. We have like 2 muscles left and a nerve. All right, move up a little bit because I have to cut. Yep. All right, so now here's where one of the times where you actually do get to use your scalpel again. Okay, is again you want to have somebody push down really firmly on that base of that mandible there. And what you're going to do is you're going to come in and you are going to cut that mylohyoid. Remember, the mylohyoid is this guy that's running like this, and it terminates down here in my little stylohyoid. Okay? Notice that you can kind of see a central line right here a little bit. You'll look on your cat and you'll be able to see that as well. You're going to pick one side. Okay, hopefully you choose wisely. Because sometimes it doesn't reveal itself as well, and it's kind of like that back on the clavotrapezius. You can't go to the other side. Now, if you do have to go to the other side, just cut immediately to the other side and peel it back, and maybe that muscle will reveal itself on that other side. It's a crapshoot. I have no idea which side's gonna give me the best muscle. I don't know. So you wanna make sure that you peel back that digastric, and these guys do get kind of sinewy a little bit. So you kinda wanna make sure you've got lots of room here, so you can see this, and when you pull it back, you'll be able to reveal those other muscles. You're gonna take your scalpel, and you're going to very gently cut through that mylohyoid. Again, it's gonna be the same manner and fashion that you cut through that splenius, but even more delicately. Okay? And then, you're gonna peel back that mylohyoid. The goal is to try to keep one of the mylohyoids intact, just so that we can test on it. Oh, I chose wisely. Because you're gonna tear this side up pretty much, getting them open. But if you've got another one on the other side, we can tell that it's the mylohyoid. I'll just have it crouch through. There you go. All right, now what you can see, you can kind of pull that mylohyoid out just a little bit. Did a pretty good job, it's not too bad. But I want you to notice there's another muscle running straight up and down. Do y'all see that? That muscle running straight up and down looks kind of like my sternohyoid, correct? But it's different, it's deeper. He is my geniohyoid. Well, we know that down here, who's he going to attach to? Oh, down here, the hyoid bone. Genio means chin. So genio means he's gonna attach up here, so he's gonna attach up here to my chin. So he's my geniohyoid. So my suggestion to you is when you're naming these guys, when you're quizzing, go by where they attach. Point it, point at it, the way that I've kind of been doing it. Sternohyoid, geniohyoid. Okay, this one down here is my sternothyroid. This one is my thyrohyoid. Kind of get the drift? It's gonna help you remember the names, okay? I promise. All right, one more. I chose wisely. He is right up under there. I can see him really well. I've got this nice muscle here that's kind of coming up at an angle. He's kind of coming up under there at an angle here. He is my hyoglossus. Okay, so again, when you name him, hyoglossus. Hyo is hyoid, glossus is tongue, hyoglossus. So my three muscles here at an angle, you can name them in one motion as you review them. So my surface ones, you can go sternohyoid,